Hello, and welcome to the What is a Mega Shelter training. In this presentation, we're going to be presenting information on what a mega shelter is and what you may be doing if you are asked to work in one. The term mega shelter describes a non-traditional emergency mass care congregate shelter typically operated in facilities generally used for public assembly, such as at large convention centers, sports arenas, and stadiums. The term mega shelter is not an official term and is not listed in the National Response or Recovery frameworks. Now let's review the characteristics of mega shelters. Activated by local, state, or federal government agencies, multi-agency coordination and management with a unified command system, large, non-conventional sheltering facility, accommodation of clients with longer-term needs beyond evacuation sheltering, scope of services expanded beyond traditional shelters, and mega shelters are not defined by population size. Why a mega shelter? Mega shelters provide centralized communication and services. They improve the span of control, streamline logistics, consolidate smaller shelters that may have challenges in sustaining operations, shelter a large volume of individuals and households, control costs, natural magnets or gathering places, and quite often the infrastructure is already in place. Here we see a mega shelter set up in a stadium. The stadium floor has 92,400 square feet. And using the planning standard of 60 square feet per person, or 100 square feet for individuals with service animals or DME, we arrive at 1,425 personal spaces. For an arena, with 30,000 square feet on the floor, at those same square feet per person standards, that would allow 408 personal spaces. And finally, we're looking at the floor plan. We see 10-foot aisles on the outside and 6-foot aisles down the middle and sides. All of the dormitory areas are on the floor. If we look at an exhibit hall with a square footage on the floor of 200,000 square feet, we would only use 45,000 square feet for the dormitory space. That would allow 750 personal spaces. Now what we see is the 45,000 square feet for the dormitory spaces on the right and all of the other space usage on the left. As you can see, there are many other services that would be available, including dining, messaging, a children's area, a recreation area, and many others. Managing mega shelters. What we see in this picture is the Houston Astrodome and the Vicksburg Convention Center during the 2005 Hurricane Katrina response. Why not a mega shelter? For one, there's a lack of privacy. Second, the stress on facilities that are really designed for short event periods and not for lodging. Mega shelters essentially are a city in a city. What happens in a city happens in a mega shelter. The reluctance of facility owners due to lost revenue or potential damages, and community-specific concerns such as not being local. In this picture, we see the 2007 San Diego Wildfires mega shelter at Qualcomm Stadium. And in that same year, during the Hurricane Ike response, This photo shows us the George R. Brown Convention Center. Who are the key stakeholders in a mega shelter? The mayor, city manager, emergency management coordinator, the fire chief, the police chief, emergency medical services, the sheriff, and the fire marshal. Other key city and county departments, such as the Department of Transportation, the local hospital emergency room director, county city health departments, the American Red Cross, Salvation Army, and other faith-based organizations, the facility owners and their key operations staff, other voluntary organizations aiding in disaster agencies, disability advocacy and support agencies, the Emergency Operations Center and Joint Field Office Section Chief responsible during Emergency Operations Center operations for mass care, the private sector, and state, tribal, and federal government. As you can see, there are many key stakeholders. The 3 C's of managing mega shelters: collaboration, coordination, and communication. First, plan and prepare before the emergency to build the partnerships, identify the operational roles and responsibilities. 2. Coordination. Multi-agencies across all lines supporting the shelter. And 3. Communication. Emergency Operations Center Incident Command System provides the communication system, common terminology and language, resource requests, follow-up and tracking that enables rapid and efficient communication between elected officials, operations, personnel, media, and the public, and all other involved parties. In this diagram, we see the chain of command. This is the concept of operations. At the top is the unified command, and reporting to the UC is the operations section chief, the planning section chief, the logistics section chief, and the finance section chief, as well as a liaison officer, the safety officer, and the public information officer. Under the operations section chief are 3 direct reports: the direct services branch director, the support services branch director, and the medical branch director. Under support services is the animal group supervisor and the human services group supervisor, and under the direct services branch director is the registration group supervisor and the dormitory group supervisor. What types of services are available in a mega shelter? Client registration, facility management, security and building access control, parking and traffic control, public information, public affairs, media relations, dormitory management, food service. Other services include public health, medical, and mental health services, spiritual care, children's areas, pet sheltering, entertainment recreation, information technology, recovery info and resident messaging, family reunification, janitorial. Other services include building maintenance and engineering, logistical support/dock management, distribution of goods, donations and volunteer management, private sector coordination, laundry service, client transportation, postal service. As you can see, there are many different services available in a mega shelter. It's very important that there are integrated physical accessibility layout considerations that are understood by all workers. These include entrances, permanent or temporary ramps, parking lots, bathing facilities such as accessible showers, toilets, hygiene stations, drinking fountains, backup power supply, and open aisles and pathways. Everyone is welcome in a mega shelter. Program accessibility considerations. These include childcare, personal assistance services, interpreters, transportation, first aid, household pets, computer capability, Wi-Fi, TTY telephone capability, video relay interpreting, large print boards, and print and video information in alternate formats. These types of considerations ensure that everyone can receive equal services and everyone is welcome. Working in a mega shelter can be a very fast-paced operation. At times, you will meet and deal with clients, one right after another. You may be required to walk to various faraway points within the mega shelter, often at a very fast pace. But also know that it is not always fast-paced. There are slow periods as well. Helpful hints. Before starting your work in a mega shelter, consider the following. Wear appropriate clothing, especially comfortable walking shoes. If you have any personal essentials that you need, such as medicine, be sure to bring enough to last throughout your shift. Only bring essential items with you to the mega shelter because you may not be able to keep these items with you and there may not be a place available to secure them. In the initial days of a mega shelter, the mega shelter may have 20 or more organizations providing recovery services to clients, which will need their own equipment and space. With so many organizations involved, some of which you may never have worked with before, it will take a few days to get familiar with each other and how to work in sync together. The mega shelter management must find ways to handle and distribute all of the donations, such as clothing, shoes, and baby items that local residents may have donated. The mega shelter management will have to find ways to handle and use the people that spontaneously volunteer to help out in the mega shelter. Get to know your mega shelter. Get to know the facility and where important services are, such as bathrooms and showers, feeding, recovery services, stairs, and elevators. Know where the message boards are located that include client-specific information, actions, or events. Get to know what volunteer organizations are performing what services, where, and when. Maintain your situational awareness. Watch for residents that appear to need help, then do your best to assist them. Mega shelters are very large and moving around them may be difficult and tiring. If a resident is struggling to move around, either assist them or find someone who can. Maintain open and frequent communication with your supervisor. Take time to talk and to learn from other workers. Residents can be very emotional when they first arrive at the mega shelter, but as their time in the shelter goes on, their sadness will be replaced by hope. Maintain your mental health. Working in a mega shelter can be very emotional. You may meet and talk with clients so deeply affected by a disaster, one right after another. Dealing with such clients in large numbers can easily wear on your mental state. Doing so hour after hour can have a major toll on you and your efforts to help others. To ensure that you are able to help others, take the following steps to maintain your mental health. Know your emotional limits and don't be afraid to act on them. Make sure that you take breaks, including meal breaks. Do your best to work your shift hours, then leave the mega shelter. It's easy to spend extra time when things are busy. But if you feel that you have had enough or need a mental health break, ask your supervisor if you can step away for a while, then do so. Know areas inside or outside of the mega shelter where you can get away. Learn to lean on your fellow workers. Sharing your feelings is one way to cope with your emotions. The Red Cross disaster mental health workers are available to assist you. And, besides watching out for yourself, watch out for others. The Red Cross role in mega shelters. The Red Cross is a convener and participants in mega shelter task forces. Red Cross services generally provided include dormitory management and registration. Dormitory management, layout considerations, highly restricted area, access only for registered shelter residents and authorized dormitory staff and support personnel. No exterior windows or unsecured entrances and exits. Separate areas for families, single men, single women, and shift workers. Quiet areas for those with health and mental health considerations. Easy access to restroom and bathing facilities. Lighting. And client access to power supply. For example, to charge their cell phones. Dormitory management. Various staff functions. Monitor sleeping area for safety and security. Ensure information sharing to residents and staff. Ensure sanitation, cleanliness, hygiene. Supporting residents' needs. Establish post and ensure dormitory rules are followed. Monitor rumor control. Engage residents in activities in support of shelter operation. Be present and listen. Monitor population trends. Complete population counts, situation reports, and incident reports. Conduct resident meetings. Make referrals. Registration. Line and crowd management. Welcome and greet guests. Assess survivors' needs for access and functional needs, disabilities, and pets. Provide referrals. Collect and report basic registration data. Monitor access to shelter, including partners, media, VIPs, and visitors. And monitor residents' departures and arrivals. Resources. The Mega Shelter Planning Guide. The purpose is to provide public assembly venues, their communities, emergency managers, shelter operators, and others involved in mega sheltering with a comprehensive all hazards guides to formulate and implement plans and procedures. This was developed in October of 2010 through partnership of the International Association of Venue Managers and the American Red Cross, along with many other partners. The Mega Shelter Planning Guide. The objectives. Assist facilities and their communities in the development of an all-hazards mega shelter operational plan. Implement common terminology and operational standards for mega shelters. Provide a resource of reference documents and informational sources to assist in the planning and operation of mega shelter. Evaluate the potential outcomes a mega shelter will have on a community, and establish a sustainable mega shelter planning task force in a community. The Mega Shelter Planning Guide includes planning, preparedness, readiness, response, and recovery action steps. A concept of operations, the structure to create a mega shelter plan by operational function, including considerations, supporting tasks, and resources, standards and indicators, a roles and responsibilities matrix, and diagrams and staffing guidelines. Additional resources: the Non-Traditional Shelter Concept of Operations Template, Non-Traditional Shelter Case Studies, and the Multi-Agency Sheltering Plan Template. If you have additional questions, you can send an email to megashelter@redcross.org. Thank you very much for your attention during this training and for the great work that you're going to do assisting disaster survivors.